1. A nurse is performing a shift assessment and observes a patient with a sudden onset of slurred speech, facial drooping, and right-sided weakness. What is the nurse's immediate priority action? Answer. Activate the stroke alert system and notify the healthcare provider immediately. Rationale. These are classic signs of a stroke, which is a medical emergency. Rapid intervention can reduce long-term neurological damage and improve outcomes. 2. A patient reports chest pain rated 9 out of 10, is diaphoretic, and has a blood pressure of 88/56 mmHg. What should the nurse do first? Answer. Place the patient on continuous cardiac monitoring and notify the healthcare provider immediately. Rationale. These are signs of a possible myocardial infarction or cardiogenic shock. Continuous monitoring and prompt intervention are essential for survival. 3. During assessment, a nurse notes crackles in both lung bases and bilateral lower extremity edema. What should the nurse assess next? Answer. Assess the patient's oxygen saturation and respiratory effort. Rationale. Crackles and edema suggest fluid overload, possibly due to heart failure. Assessing oxygenation ensures early detection of respiratory compromise. For a nurse is assessing a patient with a new tracheostomy and observes copious secretions and labored breathing. What is the nurse's priority action? Answer. Suction the tracheostomy to clear the airway. Rationale. A patent airway is always the top priority. Clearing secretions ensures adequate ventilation and prevents hypoxia. 5. A nurse is assessing 4 patients. Which patient should be seen first? 1. A patient with stable vital signs complaining of a headache. 2. A patient with a respiratory rate of 8 breaths/min. 3. A patient requesting assistance with ambulation. Or 4. A patient awaiting discharge instructions. Answer. The patient with a respiratory rate of 8 breaths/min should be seen first. Rationale. A respiratory rate this low indicates respiratory depression and potential compromise, which is life-threatening and requires immediate intervention. 6. A nursing assistant reports that a post-op patient's dressing is saturated with blood. What should the nurse do first? Answer. Assess the surgical site and vital signs. Rationale. Direct assessment is necessary to determine the extent of bleeding and assess for signs of hypovolemia or shock. 7. During a skin assessment, a nurse notes a non-blanchable red area over a patient's sacrum. What should the nurse document this finding as? Answer. Document it as a stage 1 pressure injury. Rationale. Non-blanchable erythema indicates stage 1 pressure injury, which requires documentation and preventive measures to avoid progression. 8. A patient receiving opioid pain medication had a respiratory rate of 10 breaths/min and is difficult to arouse. What should the nurse do immediately? Answer. Stop the opioid medication and notify the healthcare provider. Rationale. Opioids can cause respiratory depression. Withholding the drug and notifying the provider prevents further compromise and allows for possible reversal. 9. A nurse is assessing capillary refill on a patient's toes and notes a delay of more than 3 seconds. What is the clinical significance of this finding? Answer. It indicates poor peripheral perfusion. Rationale. Delayed capillary refill suggests compromised blood flow, which may be due to vascular disease or shock and requires further investigation. 10. A nurse is conducting a neurological assessment and notes unequal pupil size that is new for the patient. What should the nurse do next? Answer. Notify the healthcare provider immediately. Rationale. New onset anisocoria may indicate increased intracranial pressure or neurological damage and requires immediate evaluation. 11. A nurse is assessing a post-operative patient who is complaining of increasing abdominal pain and a rigid, distended abdomen. What should the nurse do first? Answer. Notify the healthcare provider and prepare for possible surgical evaluation. Rationale. These are signs of potential peritonitis or internal bleeding, which are surgical emergencies. 12. A nurse is precepting a student nurse during assessment. Which action by the student requires intervention? 1. Palpating the carotid arteries simultaneously. 2. Using the diaphragm of the stethoscope to assess breath sounds. 3. Measuring blood pressure in both arms. Or 4. Asking the patient about pain location and intensity. Answer. Palpating the carotid arteries simultaneously requires intervention. Rationale. Simultaneous palpation of carotids can decrease cerebral perfusion and cause syncope, making it unsafe practice. 13. During assessment, a patient with a history of diabetes has warm erythematous skin on the lower leg with drainage. What is the nurse's priority concern? Answer. The patient may have a soft tissue infection like cellulitis requiring immediate treatment. Rationale. Diabetic patients are prone to infections that can progress rapidly. Early intervention prevents complications. 14. A nurse is caring for a patient who has not voided for 6 hours post-catheter removal and reports lower abdominal discomfort. What should the nurse do first? Answer. Perform a bladder scan to assess for urinary retention. Rationale. A bladder scan is a non-invasive method to evaluate urinary retention, which guides appropriate intervention. 15. A nurse is assessing a patient with suspected dehydration. Which assessment finding is the most reliable indicator of fluid status? Answer. Daily weight. Rationale. Daily weights reflect subtle changes in fluid balance and are more accurate than skin turgor or mucous membranes. 16. A nurse is assessing 4 patients. Who should the nurse assess first? 1. A patient with chronic back pain. 2. A patient with a glucose level of 400 milligrams per deciliter. 3. A patient complaining of new onset chest pain. Or 4. A patient awaiting discharge education. Answer. The patient with new onset chest pain should be assessed first. Rationale. Chest pain may indicate cardiac ischemia, which is life-threatening and requires immediate evaluation. 17. A nurse finds a patient with altered mental status, dry mucous membranes, and poor skin turgor. What is the nurse's initial action? Answer. Assess vital signs and initiate fluid replacement as ordered. Rationale. These are signs of dehydration, and assessing stability while preparing to correct fluid loss is essential. 18. A nurse is delegating tasks to an unlicensed assistive personnel UAP. Which task is appropriate to delegate? 1. Assessing bowel sounds. 2. Administering a cleansing enema. 3. Evaluating pain level. Or 4. Teaching incentive spirometry. Answer. Administering a cleansing enema is appropriate to delegate. Rationale. UAPs can perform non-invasive, routine tasks like enemas, but cannot assess, evaluate, or teach. 19. A nurse is assessing a post-op patient who suddenly becomes restless and short of breath. What should the nurse suspect and do next? Answer. Suspect a pulmonary embolism and notify the healthcare provider immediately. Rationale. Sudden restlessness and dyspnea in a post-op patient may indicate a PE, a life-threatening emergency requiring urgent care. 20. A nurse assessing a patient notices yellowing of the sclera and dark urine. What laboratory value should be assessed next? Answer. Assess the patient's bilirubin level. Rationale. Jaundice and dark urine suggest liver dysfunction or hemolysis. Bilirubin level confirms the diagnosis and guides further management. 21. A nurse is assessing a patient with COPD who is using accessory muscles to breathe and has an oxygen saturation of 88% on room air. What is the nurse's immediate action? Answer. Apply prescribed oxygen and position the patient in high Fowlers. Rationale. Supplemental oxygen and optimal positioning promote lung expansion and improve gas exchange in patients with respiratory distress. 22. A nurse is assessing a patient with a newly applied cast on the leg. The patient reports numbness and tingling in the toes. What should the nurse do first? Answer. Assess distal pulses and capillary refill. Rationale. Numbness and tingling may indicate compromised circulation or compartment syndrome, requiring prompt neurovascular assessment. 23. A patient presents with confusion, low-grade fever, and positive Kernig and Brudzinski signs. What should the nurse suspect? Answer. Suspect meningitis and initiate isolation precautions. Rationale. These signs are indicative of meningeal irritation. Meningitis requires droplet precautions to prevent transmission. 24. During an assessment of an elderly patient, the nurse notes significant weight loss, dry skin, and bruises in various stages of healing. What is the priority nursing concern? Answer. Suspect elder abuse and report to appropriate authorities. Rationale. Unexplained injuries and neglect in vulnerable populations must be reported for patient protection and legal compliance. 25. A nurse is assessing a patient's cranial nerves and notes that the patient has difficulty swallowing and hoarseness. Which cranial nerve may be affected? Answer. Cranial nerve X, vagus nerve. Rationale. The vagus nerve controls swallowing and vocal cord function. Impairment can cause these symptoms. 26. A patient's skin assessment reveals multiple purple pinpoint lesions. What should the nurse document this finding as? Answer. Document as petechiae. Rationale. Petechiae are small hemorrhagic spots under the skin that may indicate a bleeding disorder and require further evaluation. 27. A nurse is assessing a patient who has not had a bowel movement in 3 days and complains of abdominal discomfort. What is the appropriate nursing action? Answer. Auscultate bowel sounds in all 4 quadrants. Rationale. Abdominal assessment should begin with auscultation to determine the presence or absence of bowel activity before any palpation. 28. During physical exam, a nurse auscultates a bruit over the carotid artery. What should the nurse do next? Answer. Notify the healthcare provider and avoid palpating the artery. Rationale. A bruit suggests turbulent blood flow, often from stenosis. Palpation could dislodge a plaque and cause a stroke. 29. A nurse finds that a patient with a history of liver disease has abdominal distension and a fluid wave on assessment. What condition should the nurse suspect? Answer. Suspect ascites. Rationale. Fluid wave and distension are signs of ascites, commonly seen in liver failure due to portal hypertension and hypoalbuminemia. 30. A nurse is assessing an infant and notes a sunken anterior fontanelle. What does this finding indicate? Answer. It indicates dehydration. Rationale. A sunken fontanelle in infants is a key sign of fluid volume deficit and should prompt immediate hydration assessment. 31. A patient newly diagnosed with hypertension presents with a pounding headache and blurred vision. What should the nurse assess immediately? Answer. Assess the patient's blood pressure. Rationale. These are signs of hypertensive crisis, requiring immediate blood pressure measurement to guide urgent treatment. 32. A nurse is performing a musculoskeletal assessment and notes crepitus in the patient's knee joint. What does this indicate? Answer. It may indicate joint degeneration or osteoarthritis. Rationale. Crepitus is a grating sound or sensation often associated with cartilage breakdown in degenerative joint conditions. 33. During a respiratory assessment, a nurse hears high-pitched, musical wheezing sounds during expiration. What is the likely cause? Answer. Narrowed airways due to conditions such as asthma. Rationale. Wheezing is caused by airflow through narrowed passages and is commonly associated with asthma or bronchospasm. 34. A patient with a urinary catheter reports chills and lower back pain. The nurse notes a temperature of 102 degrees Fahrenheit. What should the nurse suspect? Answer. Suspect a urinary tract infection progressing to pyelonephritis. Rationale. These symptoms suggest an upper urinary tract infection, which can be serious and requires prompt intervention. 35. A nurse is assessing a patient with a history of heart failure who suddenly develops frothy sputum and severe dyspnea. What is the immediate action? Answer. Place the patient in an upright position and apply oxygen. Rationale. These signs indicate acute pulmonary edema, and upright positioning with oxygen support helps reduce pulmonary congestion. 36. During assessment, a patient exhibits a positive Trousseau sign. What electrolyte imbalance should the nurse suspect? Answer. Suspect hypocalcemia. Rationale. A positive Trousseau sign, carpal spasm with BP cuff inflation, is a classic sign of low calcium levels. 37. A patient with chronic kidney disease has dry, flaky skin and severe itching. What lab value should the nurse monitor closely? Answer. Monitor blood urea nitrogen BUN and creatinine levels. Rationale. Uremic toxins due to kidney dysfunction can lead to pruritus. Elevated BUN and creatinine reflect poor renal clearance. 38. A nurse auscultates a pericardial friction rub in a patient with chest pain. What condition should be suspected? Answer. Suspect pericarditis. Rationale. A pericardial rub is a hallmark sign of inflammation of the pericardial sac and helps differentiate pericarditis from other causes of chest pain. 39. A patient reports feeling dizzy and lightheaded when standing. The nurse measures blood pressure and finds it drops significantly from sitting to standing. What is the condition? Answer. Orthostatic hypotension. Rationale. A significant drop in BP upon position change indicates orthostatic hypotension, often due to volume depletion or medication effects. 40. A nurse is assessing 4 patients during morning rounds. Who should the nurse assess first? 1. A patient with a Glasgow Coma Scale GCS score of 8. 2. A patient requesting pain medication. 3. A patient needing a dressing change. Or 4. A patient asking to ambulate? Answer. The patient with a GCS score of 8 should be assessed first. Rationale. A GCS of 8 indicates a severe decrease in neurological function and possibly compromised airway, which is a critical priority. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.